Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, how to get 30, how to get 20, 20, 20, how to get 20, 20, how to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
How do you feel great on vacation? Like really good? Easy. You go to Aruba. You'll spend your time relaxing on cool white sand beaches and floating in healing blue water. You'll immerse yourself in natural wonder and find your center on an island where things move at your speed. You won't just feel great, you'll feel relaxed, renewed, and ready for life. That's the Aruba effect. Plan your trip at aruba.com.
I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. In this week's episode, I talked with Dr. Reid Nichols. She's a pediatric orthopedic surgeon at Nemours in Wilmington, Delaware. We talked about all the ways that kids' legs can look not quite right, why they walk funny, and why it's okay. There was one condition that we talked about that deserves extra attention. It's developmental dysplasia of the hip, which is an abnormal development of the head of the femur inside of the hip socket, and that can cause mechanical instability of the hip joint. It's not uncommon, and if it's treated early, you can save a person from a lifetime of hip issues. A lot of parents aren't aware of this condition, and I often refer my young patients to be evaluated, but some parents don't follow up on my recommendation. This is a big deal diagnosis that should never be missed. I asked Dr. Nichols to explain why we should care.
Why we care about this is it can lead to a lot of disabilities later on. And we used to not catch hip dysplasia so fast, but now we do. So if it's the firstborn, if it's a female, if there is a most important thing, if there's a family history, you should definitely be thinking about, I think I should just get an ultrasound between 4 and 6 weeks. And the pediatrician should be evaluating. So can the knees drop out to the side equally? That is a huge sign. Really good thing to know. If you bend up the knees, now you can actually make this different, but in general, if you bend up the knees and the knees are at the same height, that's beautiful. If one was really short compared to the other, that's a problem because that means the hip might be out the back. So we want to be super vigilant about breech, firstborn, family history, female. Those are all the F's that we think about. If things were really tight in utero, you can also, if it's a really big baby, you might want to just be a little bit more cautious about looking for it. Then I make sure that I keep talking about that. I examine, I see a lot of club feet, so I see them once a week. I look at every single baby's hips, no matter what they're in there for. And if there's a sibling in the room too, I might look for, if there's a new baby in their family, I still examine the hips.
If you have one of those Fs, you need to ask your pediatrician to order an ultrasound. And if your pediatrician orders an ultrasound at 4 to 6 weeks of age, go get it done.
So we really like those babies' hips not to be swaddled with the knees touching or the legs straight and together. That is, if I can give you one bit of advice that you could really make a difference in the health of your child's hip, it is making sure that we do not swaddle those legs tight and close together in an extension. So it's kind of crazy. There was a study that was presented at one of our pediatric meetings that they couldn't understand, I think it was in Australia, why the rate of hip dysplasia was increasing. I think it was like by 5%, or it was a number that, I'm sorry, I can't quote the exact number right now, and it turned out that they had health workers going to the parents' houses postpartum, and they were all teaching to swaddle. So unfortunately, they were swaddling the legs in extension and very tightly, and it was creating some pretty significant problems. But luckily, they caught it and they changed their practice. You have to also be careful about like what swaddlers, even the Sleepsacks, which ones are really accepted by the, not all, like some of them are, they just make their own and it's not accepted by the American Pediatrics Association or any of that, and not necessarily fortified and supported by the orthopedic societies. But the thing to remember is that if your Sleepsacks getting a little small, it can do the same kind of pulling the legs together. So let them be free, up and out. That's the most important thing. I also don't necessarily say for people to swaddle the upper extremities too tightly. Babies break, if they kind of stop breathing too long, they startle. And I like them to be able to startle. So
that's a good point.
Not proven, but just something I'm always thinking about.
Swaddling is so complicated.
Yes, it is. And, I think you just do your best, but to let the legs be freer and up and out is important. Even if your baby is in the NICU, for some reason, still make sure that the nurses are letting those hips go up and out. We're always educating our nurses here and our doctors for hip health.
You can find a list of tips for proper swaddling and a list of hip-healthy sleep sacks on the International Hip Dysplasia Institute website, or you can buy them on my shop page. Those links are both in the show notes. In an upcoming episode, I talked to Dr. Jacob Schultz, a pediatric orthopedic surgeon at Montefiore in the Bronx. We talked about some of the painful orthopedic conditions that show up in older kids, and one of the things we touched on was the consequences of hip dysplasia later in life. Here's what he shared from his experience.
In the older kids, we do see those kids who have probably had a very mild version of what we now call hip dysplasia or developmental dysplasia of the hip that was never severe enough that it was noticed when they were younger or developed a little bit later in life and start to have hip pain. And I have a partner who has a particular interest in this. And so sometimes that hip pain that the early or later teenagers are getting can be this dysplasia and results in some instability. The hip is a really solid joint. I like to think of the joints. I give joints different names, and the hip joint is the Toyota of joints, right? It turns on every day. It's always reliable for you. Whereas your shoulder is like the Porsche of joints. It does amazing things, but one little thing and it's in the shop for a couple of weeks. So, your hip should be really stable. And when it's unstable, when the socket doesn't cover the ball like it should, and the ball kind of moves around in there, all of a sudden it's rubbing the cartilage, it's rubbing the labrum, the tissue around the hip joint, and that can result in pain. And so we see that not infrequently in teenagers. And it's a lot of it, once again, physical therapy is a great way to go. But that mild hip dysplasia can often end up with surgery to try and preserve that hip so that we don't end up with a hip replacement when we're 20 or 30, but hopefully we get it when we're 50 or 60. And that can be a real big win.
Pediatric orthopedics has lots of big wins. Kids' skeletons develop in a really unique way because of the molding that happens when they're in utero and their growth plates are open. So kids have tons of interesting orthopedic issues that only happen to them. From walking bow-legged to growing pains, I cover many of these common issues in episode 62 and upcoming shows, episodes 63 and 64. Be sure to follow the Pediatrician Next Door in your podcast app so you don't miss those episodes. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.